Dr. Jason Sioni, sir, Dr. Preeti Galgali, ma'am, Dr. Shibu K, Dr. Ojos, Dr. Jayaraman, Dr. Narayanan, Dr. Johnny Sebastian, Dr. Ranjit, Dr. Naushad, and Dr. Deepa, and all those who have joined today, a very, very good evening. If we ask someone which is the most happening pediatric subspecialty today, the answer is loud and clear. It's AHA Kerala. Why? All the credit goes to this young office bearers and young and dynamic office bearers of AHA Kerala. And in fact, IAP Cochin is really, really happy to be associated with AHA Kerala and proud that we are also a part of this inaugural CME of this academic session, Meet the Stalwarts. Without much delay, let me move on to my duty of inviting all the guests. First, let me invite the chief guest for today, Dr. MKC Nair, sir, the most famous neurodevelopmental pediatrician in Kerala and India. Sir is the founder director of CDC and the former vice chancellor of Kuhas University. Welcome, sir. Dr. Kamath, sir, I think he hasn't joined. I'll welcome him in his absence.
He's there.
Okay. Now let me welcome Dr. S.S. Kamath, sir, the former president CIAP and the former EB member. And welcome, sir. Now let me welcome Dr. Vijay Kumar, sir, the president IAP Kerala, to this meeting. A warm welcome to Dr. Jason Sioni, sir, today's moderator for the CME, and Preeti Galgali, madam, today's main speaker. I extend my warm welcome to Dr. Shibu K, President AHA Kerala, Dr. Ojos, President-elect IAP Kerala, Dr. Jayaraman, past President IAP Kerala, and Dr. Narayanan, the National EB member, to today's meet. A very, very warm welcome to Dr. Johnny Sebastian, Secretary IAP Kerala, Dr. Ranjit, in charge of South Zone AHA, Dr. Naushad, President IAP Cochin, and Dr. Deepa Janardhanan, Secretary AHA Kerala. I also extend a very, very warm welcome to all those who have joined today. And in fact, on behalf of IAP Cochin, I extend all the very best to all your programs. Thank you very much.
Thank you, ma'am. May I now invite Dr. Naushad, the vibrant president of IAP Cochin, for the presidential address. Sir is a consultant pediatrician in General Hospital, Ernakulam.
Respected Chief Guest, Dr. MKC Nair, former VC Kuhas, Guest of Honor, Dr. S.S. Kamath, sir, National President, Dr. Vijay sir, President Kerala, Dr. Joso, President-elect IAP Kerala, Dr. T.P. Jayaraman, sir, Dr. Narayan, sir, Dr. Ni, sir, Dr. Ranjit, Dr. Shibu, AHA Chairperson, Secretary, Dr. Deepa, Dr. Jason, IAP Kerala, and today's speaker, Dr. Preeti, and other dear participants. First of all, let me thank IAP Kerala for giving IAP Cochin to host this webinar series and giving me an opportunity to address you all. As you know, adolescence is a part of phase of life between the childhood and adulthood from 8 and 80. It is a unique stage of development, laying the foundation of good health. We all know that minority of the adolescents are exposed to escalating violence, leading to physical and sexual abuse, as well as child labor, child trafficking, and malnutrition, and many other issues. IAP is committed to improve the physical and mental health of the adolescent children, but many of the practicing pediatricians does not have a complete knowledge in dealing with these issues. I am sure that this webinar series will help us in addressing these issues a lot. Once again, I thank you all on behalf of IAP. Thank you.
Thank you, sir. Dr. Shibu K is the dynamic chairperson of AHA Kerala. He is a consultant pediatrician in Malappuram Taluk Hospital, and sir is the backbone of all AHA Kerala activities. May I invite sir for addressing the gathering.
Dr. Sredas.
Respected MKC sir, Sachidananda sir, Preeti madam, Vijay Kumar sir, Jason sir, Joseph sir, TP Jayaraman sir, Narayanan sir, Johnny sir, Naushad sir, Dr. Rega, Dr. Ranjit, Dr. Deepa, and other respected dignitaries. A warm good evening to all. On behalf of AHA Kerala, I would like to express our sincere gratitude for supporting and actively participating in all AHA activities. Today, we are inaugurating the webinar series on adolescent pediatrics, Meet the Stalwarts, and we are planning to conduct this type of webinar series on once in 2 to 3 months. We have already released 5 modules last year, and this time we are releasing modules on adolescent relationships, AHA syndrome, family life education, exam stress, and protective factors in adolescence. And we are planning to conduct workshop on anger management, suicide prevention, and adolescent counseling this year. Last week, we have conducted various activities across the all district in International Adolescent Healthcare Week, and I would hope all will participate and support future AHA Kerala activities. Thank you. Thank you all.
Thank you, sir. Dr. Vijay Kumar, sir, the State President of IAP Kerala, needs no introduction to us. Sir is the Head of Department of Pediatrics, Government Medical College, Manjeri, a doyen in the field of pediatric endocrinology, a great academician, and whatnot. May I invite Vijay Kumar, sir, to address the gathering.
Respected MKC Nair, sir, Dr. Sachidananda Kamas, sir, and Dr. Jason, sir, and the speaker of the day, Dr. Preeti Galgali, madam, and Dr. Johnny Sebastian, the Secretary of IAP Kerala, and the pillar behind all the presidential action plan of this year, and Dr. Shibu, the chairperson of AHA Kerala, Dr. Naushad, president of IAP Cochin, Dr. Deepa, secretary AHA Cochin, and Dr. Rekha Sakriya, secretary IAP Cochin, and Dr. Sanju Gobi Mohan, Dr. Jose O, president-elect, Dr. TP Jayaraman, sir, the president, immediate past president, and at this juncture, I congratulate Jayaraman, sir, and Johnny for getting the best branch award in India, IAP Kerala, and Dr. Narayanan, Dr. Ranjit, Southern EB member of Central AHA, and happy to be the part of the inaugural program of the AHA Kerala, the beginning of the series of webinar, the Meet the Stalwarts. Actually, this is the need of the hour. And I think adolescent health is the most neglected part of our pediatric curriculum. Yesterday, I'll just tell one story. Yesterday, I had an occasion to talk about menstrual irregularities in IAP Trivandrum. And the chairperson was Dr. Sangeeta Menon, a gynecologist. Actually, after the end of that talk, the madam told me that this is the first time I am hearing a talk on menstrual irregularities from a pediatrician. So I think we are not giving much importance to the menstrual part of an adolescent. And actually, I think the menstrual history is the most vital side of an adolescent. So we are interested in heart rate, respiratory rate, and all other things, but not menstrual side. And we are interested in growth chart, BMI chart, and not a menstrual chart or a menstrual calendar. So that is the need of the hour, I think. And I'm very happy to note that AHA Kerala is starting a series of webinar for enriching the pediatricians about the adolescent problem. And the topic of today's adolescent relationship, and presented by none other than Preeti madam. I wish the program and the remaining the programs all success. Jai Hind and JEMP.
Thank you, sir. We are blessed to have with us Dr. MKC Nair, sir. Sir is the former Vice Chancellor of COHAS and Founder Director of Child Development Center, Kerala. Sir is a renowned researcher in developmental and adolescent pediatrics. Sir was the past National President of IAP National Neonatology Forum, Indian Clinical Epidemiology Network, and founder secretary of Growth and Development Chapter and Adolescent Pediatrics Chapter of IAP. Sir has more than 200 articles in various international and national journals to his credit. I humbly request Dr. M.K.C. Nair, sir, to inaugurate the webinar series.
Respected Dr. Naushad, Dr. Shibu, Dr. Vijay Kumar, Dr. Jayaraman, TP, Dr. Narayanan, my good old Kamath, and Dr. Jason, Jose, and all other dignitaries, the new ones, Sweda, I see all the names, Sarojam, all that, everybody, Ranjit, everybody. It's a great occasion because I'm so happy that next generation is taking the effort forward. And the moment the next generation come, things, everything become in a different style. And that style difference is what make a subject, get rejuvenated. And that's very important. And a new star has come in adolescent, and that is Preeti Galagadi. That is very important. And she's talking on relationship and relationship counseling. If I look at it, the positive part is that relationship bring the essence to life. So that is the most positive part. The negative part will be you hear history of lot of tragedies happening because you get overwhelmed by relationship. And the main reason is, I think we must stop using the word love and we need to use the word caring. Refuse to use the word love. When 99% of time, when people, at least 90% when they say, I love you, it means it's really not anything. It is just that I like that face, I like that body, I like to see it, I like to touch it, I want to eat it up. That's all. Whereas caring is a phenomena that is for the newborn baby to elderly. Even at the last thing, the caring is there. So I think we need to, IAP may seriously think of, let's not use the word love. Let us start using the word caring to the adolescent, because that is the greatest thing that happens. And so we need to train youngsters on counseling problem, relationship and the relationship maybe with colleagues, maybe with parents, maybe with teachers. And after the COVID, the study that IAP, Kerala, and with the UNICEF support is doing, it is showing that relationships are totally changed. The teachers are saying that the children who didn't come to school for 2 years just don't know how to behave, just don't know how to be disciplined, just don't know so many things. It's not their fault. We need to work hard on that. And who better than Preeti Galagadi, the IAP adolescent woman in India. Thank you. I declare it's inaugurated.
Thank you, sir, for those inspiring words. We have with us as our guest of honor, Dr. S.S. Kamath, past president and past national president of IAP. Sir is a renowned pediatrician with more than 25 years of committed service in IAP. Sir has played a lead role in baby-friendly hospital initiative in Kochi and later in Kerala, and also has received the Best Doctor Award of Government of Kerala in 2012. A socially committed pediatrician, Sir was involved in the movement against tobacco and was also one of the respondents of the landmark judgment of Honorable High Court of Kerala banning smoking in public places. May I invite Sir to address the gathering.
Good evening. Good evening to all. Thanks, Dr. Sweta, for a nice words. I think, I don't know, it is a teamwork which has led to all these credits which you have given to me. It's all the teamwork and the Kerala. I can vouch that Kerala has been forefront for everything. What I'm glad that today, with the President, Dr. Presiding Officer, Dr. Naushad, Dr. Vijay Kumar, Dr. Shibu, Chief Guest, and the man behind all these activities in throughout the Kerala, name it from the ages, that is the newborn care to the adolescent care. Now sir has moved on to the youth care also, of youth also. So the man of all time, different activities, which has ignited all of us to work in various fields where there is a deficiency. Dr. MKC Nair and other dignitaries on this platform. It's glad that I have been invited for this program, which is closest to my heart. That is 25 years ago, when our national conference was hosted in Cochin after a long gap of 10 years or so. That time, Dr. MKC Nair had mentioned that those days when no one was talking about the adolescent, that time Dr. MKC Nair has suggested that about the theme as adolescents, need of the hour. Since then, adolescent topic has been taken from the local level to the global level as our leaders from various fields like Dr. Swati Bhave, Dr. Preeti, various persons other than Dr. MKC Nair has taken this nationally as well as to the global level. So everything started with Kerala. So I'm glad that this also, as at this juncture, as Sir has mentioned about after a long gap of our lockdown, what relationship we are having or what relationship the adolescents are having. Those studies are on the way, and of course we'll be able to get astonishing figures of various negatives what we are going to face hereafter. So this kind of webinar series for the children of or the adolescent, which is the need of the hour, will make a difference in we the pediatricians, as well as taken it forward to the adolescents of this part of the country. So I congratulate the leaders who have taken this webinar series to meet the stalwarts, and in that the first speaker as such is Dr. Preeti Galgali, whom I know for the past 20 years has worked in this field, most sought after speaker for the adolescent topics, ably moderated by our pediatric drug formulary person as well as adolescent man who have started in the Kerala also, Dr. Jason. So wishing you all a very good academic session for this as well as this today's program, as well as for the future webinar series, to Dr. Shibu as well as Dr. Deepa to take forward this to the next level of something which has given from IAP Kerala. Thank you very much for calling me for this function. Thank you.
Thank you, sir. May I invite Dr. Jose O, President-elect IAP Kerala, for the felicitations. Sir is the Additional Professor of Government Medical College, Alappuzha, the Secretary of Pediatric Allergy and Immunology Group, Central IAP, and the President of Pediatric Allergy Association of India. Over to you, sir.
Good evening. Thank you, Sada. Most respected Chief Guest today, Dr. MKC sir, Dr. Sachidananda Kamath, the Chief Chairperson today meeting, Dr. Naushad, AHA Chairperson, Dr. Shibu, Dr. Deepa, Dr. Ranjit, Jason sir. Today, the speaker, Dr. Preeti Galgali, State IEP President, Dr. Vijay Kumar, Chief Secretary, Dr. Johnny Sebastian, immediate past President, Dr. T.P. Jayaraman, our T.P. Jayaraman or Narayanan, immediate past President and EB member, and all the senior members of IAP Kerala and AHA Group. I take the opportunity to congratulate AHA Group to starting the series of webinar of the importance of adolescent issue we are facing. As we know, we are more concentrated regarding the immunization, infection disease control programs, and growth and development concerns. The pre-pandemic COVID and post-pandemic COVID make a lot of issues in related to adolescents regarding the programs. I think AHA get taken a very great step forward to conduct a series of webinar to narrate our pediatrician about the how to deal with adolescent issues. To deal with the issues taken by due to the COVID, adolescent had a lot of issues are facing now. As Dr. M.K. Sir mentioned, this is the issue we have to take in the community to do the something regarding the adolescent issues, to tackle the common issues of adolescent programs. Today we have another expert in the field of adolescent, Dr. Preeti Galgali, to talk on enlightening us regarding the issues. And I think this series of webinar will enlighten all the IAPNs of the Kerala for regarding that tackling the adolescent issue in the coming days. I wish you all the best program and
Deepa, you can continue. I think he's stuck. You can.
Yeah.
All
Shweta?
Sweta?
Okay, ma'am. Okay, ma'am. Thanking sir in his absence. May I invite Dr. T.P. Jayaraman sir for the felicitations. Sir is the immediate past president of IAP Kerala and consultant in charge of DEIC Kerala. Over to you, sir.
Good evening, everybody. Thank you so much for the invitation. Respected MKC sir, Sachi, Dr. Preeti Galgali, Dr. Jason, Dr. Jose, Dr. Vijay Kumar, Dr. Deepa, Shibu, Ranjit, and all the other dignitaries on the dais. Before I go, I want to congratulate IAP Cochin for arranging this wonderful series of Meet the Stalwarts in association with the AHA Kerala, and bringing a very important issue to the forum. That is, as Dr. Jose was putting, now we are having a lot of issues with adolescents, and it is a time where we pediatricians have to be geared up to meet the challenges the adolescents of the country is facing. And we have a speaker, none other than Dr. Preeti, who is an expert speaker on all these issues in adolescents. And again, I congratulate IAP Kochi for bringing National Pedicon once again to Kerala. And it's so nice that we are having our Pedicon coming to Kerala in the year 2024. And I think IAP Cochin is gearing up with the introduction of a very important program, Meet the Stalwarts. Thank you so much. And I congratulate all those people who have worked hard to bring this Pedicon after a lot of years, I think after 25 years back to Kerala. Thank you so much for this opportunity and wish the very best for the sessions to follow. Thank you.
Thank you, sir. May I invite Dr. Johnny Sebastian, the Vibrant Secretary of IAP Kerala, for the felicitations. Sir is a consultant pediatrician in General Hospital Talsheri in Kerala under Kerala Health Services. Over to you, sir.
I think sir is not there.
not join. Some issues, technical.
Yeah. I think sir is not joined, Shweta.
Okay, ma'am. May I invite Dr. Ranjit P. for the felicitations. Sir is the South Zone EB member of Central AHA, past secretary of AHA Kerala, web editor of IAP Kerala, website convener of Central IAP. Over to Dr. Ranjit for felicitations.
Thank you, Shweta. My teacher, Dr. MKC sir, who instilled us the basics of adolescent health, and respected Sachinanda Kamath sir, and our speaker, Dr. Preeti Galgali, who is an excellent academician, and respected Jason sir, State IAP President Vijay Kumar sir, Jose sir, Jayaraman sir, and AHA Vibrant team, Dr. Shibu sir and Deepa ma'am, and IAP Cochin office bearers, Naushad sir and Rega ma'am. It's a very happy occasion for all the IAP Kerala members and also AHA Kerala members to start a series that is the Meet the Stalwarts on adolescent health. It is a planned as a series in 2 months with experts all over our country. It's a great initiative by AHA Kerala, and congratulations to the team behind this webinar, and best wishes for this webinar. Thank you, JIAP.
Thank you, sir. Now we come to the main event of the day with none other than the synonym for adolescent health in India, Dr. Preeti Galagali, ma'am. Ma'am is the director and adolescent health specialist, Bangalore Adolescent Care and Counseling Center. She is the past chairperson of Central AHA, the Central IAP executive member of 2021, and ma'am has over 70 national and international publications and more than 200 national and international scientific presentations to her credit. She has received various awards, including Fellow of IAP in 2019, International Scholarship instituted by Society for Adolescent Health and Medicine USA, and Best Research Paper Awards in Adolescent Con of 2005 and 2011. It is our pleasure to have with us this stalwart and to hear the class from her. And to moderate this session, we have Dr. Jason C. Unni, a veteran pediatrician of more than 31 years of experience. Sir is an expert in pediatric and adolescent medicine, and his areas of special interest includes infectious diseases, respiratory allergy, learning disabilities, adolescent counseling, and life skills training for adolescents and children, not to mention the pediatric drug formulary. May I invite Dr. Jason, sir, to moderate the session.
Thank you, Dr. Sweta, for the introductions. I'm so happy that AHA Kerala is doing such a fantastic job. It's going to be a great series of Meet the Stalwarts in Adolescent Medicine. And to start off with, we have Preeti Galgali, and I'm sure that Preeti is going to do a great job. I'm so happy to share this forum with Dr. M.K. Nair, Dr. Sachidananda Kamath, Dr. Vijay Kumar, Dr. Jayaraman, and the whole team of Kerala AHA. Now, teen relationships is something that Dr. M.K. is also talking about. It's very important for a teenager. It's a time when he wants autonomy, and therefore his physical thinking and development come. Big changes happen during adolescence and his relationship with family and friends. In these COVID times, you had children, they're depressed, they're anxious, there's a lot of, they're seeing a lot of death and the absolute helplessness of their parents. There's no peer group interaction, and we found 2 hanging deaths here in Cochin, 1 in the north. So this is a time, it's a lot of distress for adolescents. Relationships are really suffering because at this time of their lives, it's so important that they have peer group interaction, and that they're missing out on. And I'm sure Preeti is going to give us a lot of insight on what's going to happen in the near future, because these children have lost out 10 years to 12 years old children and lost out 2 years of relationships that have been built up, a lot of ideas about how to live their life in the future. So there's going to be a lot of changes, and I hope we're going to have a lot more studies on what this pandemic has done to relationships between children, and especially adolescents and their parents and their peers. And I'm sure Preeti is going to dwell on that too. A lot of negative and positive influences have happened because the families have been together for 2 years. That also has been a good thing. The relationship between families have been good. Peer group relationship with their brothers could have been sort of cemented. So there's a lot of positives also. I'm sure Preeti is going to deal with all this, and I wish this program all success. Welcome, Preeti, for your talk.
Thank you so much, Dr. Huni. Let me just share my screen. Good evening, everybody. It's an honor and privilege to be the opening batsman of this very wonderful series on adolescent health. And we are all in awe of IAP Kerala because you're so far ahead of all of us. We even think of an idea and you've already implemented it. So that's really hats off to you. And I congratulate and thank the whole team of IAP Kerala, AHA Kerala, and also IAP Cochin, led by very able leaders, Dr. Vijay Kumar, Dr. Shibu, Dr. Noshad, Dr. Jose, Dr. Sebastian, and all other stalwarts. It's also a pleasure to see my sparkling friends from AHA, Dr. Newton and Dr. Jayaraman, and also to see the wonderful stars of AHA, Dr. Deepa and Dr. Ranjit. So I definitely cherish my human connections with whole of Kerala, and though you are friends, you mean more than family. And both friends and family are important relations for each one of us. And relationships have been in news recently. We all know about that famous case which happened a couple of days ago. All know about this. I'm sure you all have read about this, about Will Smith and Chris Rock. So what happened here? What really was a problem in this relationship?
Welcome. Felicitations to office bearers.
Okay, can everybody just keep themselves on mute? That would be wonderful.
Pediatrics neurosurgeons.
Thank you. Thank you very much. So you will all agree with me that Chris Rock, when he made fun of Will Smith's wife, he definitely needed a dose of empathy, and Will Smith himself needed a dose of anger management. And I am really indebted to IAP Kerala for allowing me to share my thoughts on this very important aspect of human relationships in front of my guru, Dr. M.K.C. Nair, and also my teacher, Dr. Jason Uni, who has taught me the nuances of life skill and of forming relationships, and also my beloved mentor, Dr. Kamath. So I'm sure if Chris Rock and Will Smith had attended our AHA life skills sessions, they would have learned how to manage their anger. And Will Smith, after Chris Rock's talk, would have gone to him and used the conflict resolution skills. He would have told Chris Rock, the way you spoke to about my wife, I felt really bad. And Chris Rock would have listened to him and said, oh, I apologize for hurting you. What do you want me to do now? So then they would have discussed the options, whether he should give a public apology or probably a personal apology, agreed on the solution and see how it goes. But what happened in reality, because Will Smith reacted and did not respond to the situation, actually, he ended up in giving a public apology. So you can see, if relationships are not properly sorted out, it can cause a lot of public humiliation and shame. And remember, both Will Smith and Chris Rock were adults, and it becomes extremely difficult for adolescents, especially if they have challenges like a disability, which Avani Lekhara had, being a paraplegic, but because of the fantastic relationships that she shared with her parents, she went on to win a shooting gold at Paralympics 2020. So you can see that relationships can make or break, and it holds good for both adolescents and for adults. And we know adolescents are vulnerable, and we'll be talking more about it as we go along, and how to help adolescents to build healthy relationships. We all are familiar with the joint family system, where the adolescents were taken well care of by the societal buffers, in the form of grandparents, uncles and aunts, and they learned how to form good relationships, and they were under their eagle eye. And now, how do things look now? Moreover, in the nuclear families, though adolescents are staying with their parents, they still need to form bonds and relationships with the extended family, with parents, uncles, aunts, and also with their siblings, cousins. But what has really changed, and more so during the pandemic, it has been the media boom. And media has it made us more socially connected, or has it increased the distances? And that is a tough question to answer, because it really depends on the way one uses the media and what kind of relationship does the family share with each other. Also, we know that during the pandemic, our relationship with food has changed, and this has led to a pandemic of co-obesity. So you see, relationship is not only between human beings, but it is also with our lifestyle. In the next few minutes, we will talk about how relationships change over the adolescent psychosocial development, over the different age groups, what are the socio-ecological determinants, how has COVID-19 influenced relationships, and through case, they talk about relationships with parents, teachers, peers, nature, also with the self, also with media, and also with the pediatrician. So let's take a dive deep into relationships. Are relationships built during adolescence? I must say here that actually relationships are built over the entire lifespan. Relationships are built when a couple conceives, or when decides to conceive to have a baby. Relationships are born, a form is yet to be conceived. So it is this relationship building, this foundation, which is extremely strong, which has to be strong to ensure that the relationships are healthy over the entire lifespan. If it is a wanted child and the mother is well nourished and happy during the adolescent period, when the baby is born in infancy, has a secure attachment, the baby develops trust, and this actually forms the foundation of a healthy relationship. But in case the mother is malnourished, is exposed to violence and abuse during pregnancy, there is a change in utero which takes place in the fetal brain. And when the child is born, the child is not only IUGR prone to develop lifestyle disorders later in life, according to the Barker's hypothesis, if they gain weight, but also is prone to develop impulse control disorders. And if the attachment is faulty in the infancy, it actually leads to unhealthy relationships. So hence the importance of adolescent care and adolescent counseling and relation building right from the preconception period going over the entire lifespan. So what happens during puberty? Well, adolescent thinks parent gets difficult, while the parents think adolescents get difficult. You know, in the adolescent period, there is a movement away from the family towards the peer. This is a movement which puts the adolescent sometimes into confusion. Also, there is that identity crisis which is going on. There are those mood swings. There is a pull and pull from the parent, while there's a tug of war, while the peers are pulling in the opposite direction. The adolescent starts questioning all the parental values. Often parents get affronted, and often the adolescent says, no, you're not my role model. My role model is my doctor, or maybe the teacher in the school. And parents should be taught, maybe counseled, not to take this personally, and just to continue with their parenting practices in an authoritative manner, with more of negotiation, and not to feel sad as the child is forming his own unique identity. So parents try to convey their thoughts. There's also the media, which further complicates the matter. Adolescent is too busy with friends, too busy with the media to really pay attention to the parent. And parent has a very difficult time to rein in the adolescent. And definitely, as an adolescent health professional, it is not only the adolescent, but also the parent which needs help. What about peers? Initially, in the early adolescent period, between 10 to 13 years, the adolescent forms a relationship, usually with the same sex peers. In the middle adolescent period, that attractions start. It could be with the same sex, it could be with the opposite sex. Experimentation starts. And during the late adolescent period, usually between 18 to 21 years, is the period when usually stable relationship and sense of intimacy grows in that period. So as health professionals, we should be aware about the change in relationships regarding parents, peers, and self. What about self? Adolescent initially gets very conscious about his body because of the body image changes which are taking place. And as they grow older, they develop a more stable physical identity. We also know about the brain. As the brain development varies over the adolescent period, it has great implications on relationships. We all know as puberty strikes, the limbic system matures. The adolescent gets very emotionally reactive, and sometimes this is misinterpreted as conflict, rebellion, and it becomes worse because often adults in their lives forget to use their prefrontal cortex, which is fully mature and which can control the emotions. So to have a goodness of fit, all the adults who are in contact with the adolescents should understand that emotional reactivity, questioning, little bit of rebellion is actually a part of normal development, and adults in their lives need to respond to these issues rather than react. We also know about reward centering, having a dopamine surge during this period. Adolescents are looking for rewards in the form of appreciation from their parents, teachers, and peers, and this makes them really happy. They're also looking for rewards in the form of academic and extra academic achievements in sports, music, and dance. And often what happens during this period is both the parents and the teachers say, forget your extra academic activities, concentrate only on academics. And adolescents who are not doing too well in their academics, in fact, feel very sad when they do not get that dopamine kick from healthy reward-seeking behavior. So they often merge into unhealthy behavior. They start taking drugs, become violent, do risky driving, speed driving, get addicted to the media, and even sometimes to food, and become sexually promiscuous, because all these unhealthy rewards actually stimulate their normative need for rewards and the dopamine kick. Hence, all caretakers, all adolescent health gate professionals should understand that adolescents need appreciation, and that too genuine appreciation to lead them gently on the right path. Having understood this, we must also understand that adolescent brain is still under construction. There are a lot of neuronal connections which are getting hardwired, and there's a lot of pruning which is taking place. So if we can train adolescents to form healthy relationships during this period, this training would actually help in hardwiring of this neuron, which will persist over the entire lifespan. So adolescence is an age of vulnerability and also an age of opportunity. Now, from what all I have been saying, you would understand that the relationship of the adolescent is in different domains. It is with himself or herself, it is with the family, the school and the peers, the community, even with the government's agencies and the media. So these are the most common domains, and we're talking about beyond this, the spiritual connection and also the connection with nature. I'll come to that a little time later. So let us take the example of an adolescent who is sexually abused. And if this adolescent is also having autism, the experiences that this adolescent actually faces would be very different from that of a neurotypical adolescent. So for this moment, let us consider a neurotypical adolescent. If this adolescent has good family connections, if she gets abused, she's given the family support, nobody blames her. In schools and in the school, she's treated as what she was treated before because of good school connectedness. Her peers do not bully her or make fun of her. The community does not shame and blame her. The government has excellent counseling facilities, both short-term and long-term, and the media handles this very sensitively and does not mention her name in the newspapers. This adolescent, even though she has faced trauma, because of the excellent relationships, her developmental trajectory will be on track. In comparison to another adolescent who has a risk where the family blames her, the school blames her, the peers bully her, the community shames her, the media shames her, there are no counseling facilities available. So this is a risk when she will actually face challenges to her learning, health, and behavior throughout the life. So as a clinical tool, which tool would help us to screen for relationships? It's none other than what we use routinely, which goes by the acronym HEADS. HEADS helps us to screen for relationship in terms of home, in terms of school, the relationship with food and body image. What is the effect of relationship on activities? Is there a tendency of drug use because of a break in relationship? Is there a tendency for self-harm or of depression? Are there any sexuality issues attached to relationship problems? Are there any safety issues? So this is an excellent screening tool which would help us to screen for relationships. Well, this is research from US, and I have no hesitation in extrapolating it to India, because what it says is that adults who experience strong connections with the school, with parents as youth, were 48 to 66% less likely to have mental health issues, experience violence, engage in risky sexual behavior, and use substances. So you can understand that healthy relationships formed in adolescence have great implications for not only now, but also in the future and probably intergenerational. So schools have to implement positive youth development programs. Parents have to talk more and listen more to their adolescents. And as health professionals, we need to screen and talk about relationships more and help adolescents to build healthy relationships. Yes, as has been mentioned by both MKC sir, Jason sir, and many stalwarts in the introduction, COVID-19 has actually given us evidence base. If relationships are not going right, what can happen? So we have a strong evidence base here in telling us, and I'm just sharing one meta-analysis, and which says that there is doubling of depression and anxiety globally amongst adolescents. There are many more studies which have been published. And as you can see, the causes are in the individual, social isolation, fear of catching COVID, in the family stressors, bereavement, abuse, in the school and in the peers, loss of peer connections, play and schooling, in the media, excessive media use, in the community and in the governmental level, where there has been initially lack of mental health services, especially for adolescents. So we have evidence base that if relationships don't go right, actually it has far-reaching implications, and all these children who have been affected during COVID, both physically and mentally and socially, will definitely need long-term follow-up. As I go into my cases, I should share with you what are the basics of relationship counseling. And this information is taken from a very good article written by MKC sir, which was published in the IJPP. And you can see the reference down there for those who want to read it. Yes. So what are the basics of relationship counseling? First, we should know what the problem is. So we take a head psychosocial history, we find out what are the relationship problems, we also find out the effect. So a mother says, my adolescent is withdrawn. Is the adolescent so much withdrawn that he does not talk to anyone? Is he so much withdrawn that he does not want to take a bath? Is he so much withdrawn that he doesn't want to take to peers? Is he so much withdrawn that he doesn't want to even go onto the media? If there is a great impact on activities of daily living and functioning, this relationship problem probably indicates the onset of a mental disorder like depression or anxiety. So now we know that if there's a relationship problem, yes, there could be problems in all the domains, but it could also be a pointer towards a mental disorder, and we should have our antenna up. For doing relationship counseling, as for all other counseling, we need to have an unconditional positive regard. A mother says, my adolescent is aggressive, and you say on your mind, oh, this mother doesn't know how to handle the adolescent. Or you think about the adolescent, what a rowdy he is. The moment you make a judgment, you lose the unconditional positive regard. You should actually not be counseling this adolescent, and you need to refer the family to another physician. Must have empathy, must have congruence. And you say by your lips, I want to help you, but in your mind you're thinking, what a difficult family this is. If you do not have congruence, again, you should not be counseling. So it's very important to have these attributes before you take up the difficult and sometimes a very challenging task of relationship counseling. You must give psychoeducation about healthy relationships. The basis is to build life skills, enhance social and emotional intelligence, teach conflict resolution and negotiation skills. And as MKC sir often says, this is actually a mantra for all adolescents. Never harm yourself, and if possible, do not harm others. I think this forms the basis and foundation of all relationship counseling. So when we talk about psychoeducation, sir mentioned about love, and I think I should also add the element of caring after having listened to him. Now, for all relationships, though this may give idea about an intimate relationship, but I think respect and equality, safety and trust, communication, mutual support, consent and boundaries, personal freedom. This is what we need to teach our adolescents, how to check whether their relationships are healthy or not. And again, once again, the foundation is, it is based on love and care. And this is an important slide to share with the adolescent. Also share with the adolescent the golden rule of interpersonal relationships, which is ratified by all religions and which says, treat others the way you would want to be treated. And it is written here, sometimes easy to talk, hard to do. Yes, it is hard, but not impossible. So if you don't like to be beaten up, don't beat others. If you don't like to be called by foul names, please watch out on how you address others. This is a very simple rule, and it needs to be taught to all adolescents. And recently, there has come up the platinum rule, which emphasizes on empathy. Treat others the way they want to be treated, which is so very important. So let's come to the case one. Now, this mother, she talked to me over the phone, and you know, the pandemic has been a very difficult period for us adolescent health professionals, where we had to juggle between a hybrid mode of counseling, calling the child and the parent for some time to the clinic, and then, you know, following up by the telecounseling mode. So this mother came for actually vaccination, and I do a quick screening, which we also published a paper on this with Dr. Rajiv Seth and others of the cancer group. We asked two questions. How are you coping with the pandemic? Are there any anxiety or stressors that you are facing? So we take these two as screening tools, and if the parent says yes, We quickly do a short counseling session with the parent and the child alone, and then we follow up by the tele mode. And that is what I have been practicing during the pandemic. So this mother said, my adolescent is very, very aggressive. She shouts back at me. And when I talked to the adolescent, she said, oh, my mother always gives a lot of time to my younger sister who is a special need child. I know she needs her time, but my mother does not give me any time at all. And when I did a screening for her and I did use the DSM-5 criteria, I realized that she was having mild depression. And then the process of CBT started for the girl, and I started counseling the mother. I told the mother as well as the child about assertive communication, talk to the mother about authoritative parenting, the importance of unconditional love, gave her a few tips to increase the dopamine, GABA, oxytocin, and serotonin in her child by spending time with the child, by skipping with the child, by doing a little bit of meditation, hugging and kissing. Well, adolescents love to be hugged and kissed in private. Also spending some time in the nature on the terrace with the child, which paid rich dividends. Also taught her strategies to reduce the sibling rivalry by spending some time alone with each child, spending time together, being an impartial mediator when there are conflicts, and having the very firm rule in the family that there would be no violence, nobody would hit anybody. So these were some of the strategies we talked about: relationship with peers, relationship with parents, and then COVID struck. Both the parents got COVID while none of these children got COVID. As this child was undergoing CBT and the mother was undergoing relationship counseling, there was a lot of change in how they felt about each other. This girl took up the responsibility of looking after the whole family. The parents were in quarantine, self-isolation at home. She cooked for the family, looked after her special needs sister, and actually turned out to be a lifesaver. So you can understand that working with the child, working with the family has a great impact. And as they went over this challenge of COVID, in my later counseling sessions, talk to them about the 10 core life skills: self-esteem, self-awareness, empathy, effective communication, interpersonal relationship, problem-solving, decision-making, creative and critical thinking, coping with stress, and coping with emotions. Well, is it that easy? Sometimes it is not that easy. Family counseling actually involves understanding the dynamics, the functioning, the adjustment of the family, and also the family relationships. So this is an important slide to consider when we talk about family counseling. Coming to peers, we all know peers are so important for adolescents. In fact, peers are a source of companionship, emotional support, also for shared activities and conversations. This child came to me a couple of years ago with the mother, and the mother said, look, he has slashed his forearm with a blade. I think he's involved in some broken relationship. Please help my son. I talked to this child, and to my surprise, he said, my friends dared me. I did it. It was exciting. So do you remember the reward center, which needs the dopamine kick? This child was having a learning problem. He was actually, isolated from all the friends. A group of friends once called him in, and just to bully him and tease him, said, then you can be a member of a peer group. And his need for belongingness was so desperate that he really did it. So you can see here the influence of. We need to document these case details because this can be a medical legal case. This is a case of in this case was dared by peers. His ambition was actually to be
Preeti, you're going on and off.
Yeah, I'm so sorry.
Your
Yeah, is my connection very bad?
yeah, I think so. It's going on and off. Sometimes it's
Going on
going.
and off? Okay, let me just change the modem then.
Reload your presentation also.
Is it okay? Is it visible?
No, your presentation is not there.
Not there now? No?
No.
Okay, then let me
It's
try
coming
again.
on. It's coming on.
Okay, I'll just try again once. Is it there now?
Yeah.
Can you see?
It's gone again.
Again, it's gone. I think 1 minute. Let me just change it again. Is it visible?
Yeah.
Is it visible now?
Yeah.
Okay. Okay, so this child was actually had an ambition of being a yoga teacher, and his parents had stopped his yoga classes because he was not doing well in studies. And the risk factors here for this non-suicidal self-injury were poor academic performance, learning disorder, poor life skills, abuse by teachers, high parental expectation, and bullying by peers. While the protective factors were that he had an interest in yoga, he had strong parental connectedness, he extremely had high level of respect for his parents, and he was religious. There was no mental disorder. And when we assessed the risk for suicide, he actually fell into a low risk category, and he was asked to see a psychiatrist in the next 48 to 72 hours. But before he left the clinic, we gave him hope to deal with his stressors, also build up his self-worth, emphasized and reinforced his protective factors and strengths, built a safety plan, and did parental counseling. As it is often seen, they never went to the psychiatrist, though we documented it on the case sheet. I had to actually counsel the adolescent, the parents, the teacher, the peers also. So you can see here the relationship building was done at the individual level. He was asked to go back to yoga. He was taught skills to handle peer pressure and bullying, also study skills. Parents were taught about positive parenting techniques. Teachers were also talked about dealing with him with empathy and sensitivity, and we took life skill sessions for peers. It was not at all surprising that after a couple of months, he came to the clinic with a prize and a certificate, having won a prize in the yoga competition. So we can see the importance of building up relationships in all the domains for an adolescent. And when it comes to life skills, I think building a relationship with self, loving yourself, and actually saying that I have self-worth, I can work on my weaknesses because I have so many personal strengths is extremely important. Developing a sense of empathy is so important, and this helps the adolescent to form relationships with community. And when we talk about empathy, we also give this example saying that if you were walking on a road and one of your friends fell in a pothole, what would you do? If you jump in the pothole and start crying with that friend, that is sympathy. But on the other hand, if you lend him a hand to actually climb up, that is what is empathy. And we definitely don't want you to be apathetic. We also talk to the adolescent about the ability to build and nurture friendly relationships, and also to be able to end relationships constructively. I had this young man who was 18 years old, studying in 12th standard. He rang me up one day. and he said, "Doctor, I'm feeling very scared because today one girl came to me and proposed to me." And I said, "No." I said, "What exactly happened? Tell me more." He said, "This girl said to me that if you don't become my boyfriend, I will commit suicide." And I'm scared because I said, "No, she will really commit suicide." Then I asked him, "What did you say?" He said, "I told this girl, I want to become a doctor. I want to get admission into the best medical college in the country. So right now, the problem is with me, not with you. You are an excellent girl. You will find many other friends. But right now, I don't have time for an intimate relationship." So he said, "I will not be able to sleep today." I said, "You did great. We'll talk about it tomorrow." The next day he called me up and he said, "Oh, doctor, thank you so much. She never committed suicide, but she made a bad face at me." So you see, how to say no is also an art which we have to teach adolescents. We have to tell to them the importance of both verbal and non-verbal communication, the importance of body language, tone, voice, and words while building up relationships. Listen very carefully to the other person while he is talking, and using assertive skills to say no to negative peer pressure. So these are one of the skills which we need to teach all adolescents, and this sometimes puts them in a turmoil. But if you give them a menu of this, they would be able to implement this practically. Doing role plays is a powerful way of teaching the adolescent how to say no. Coming to a relationship with self, yoga is excellent to develop calmness, mindfulness, compassion, sense of connectedness. Give yoga as an option, as a relaxation skill. The adolescent enjoys it, let him do it. Remember, do not force. Connection with nature also develops grounding, also tells the adolescent after night there will be day. After a failure, there would be success. We also know about the microbiota which we pick up when we roll in the sand. So these are the good connections with nature which each adolescent should be taught. What about the relationship with media? So this mother came to me and said, "I want to kill my daughter because she has shared her naked pictures with a boyfriend." This was a case of sexting, and the boy refused to delete the pictures. The child, both these adolescents were 17 years old, and this fell under the POCSO Act. So I had to contact the cyber police. The cyber police, in fact, treated this case with a lot of sensitivity. In plain clothes, they went to the boy's house and motivated the boy to delete the pictures. So the relationship with the media, we must teach our adolescents, we must give anticipatory guidance that whatever you post on the media, on the digital devices can never ever be erased. Later as an adult, when somebody does a check on what you have posted, they can see it. And if you have posted something which is unhealthy, which is illegal, it would probably impair your chances of a good career. And we must teach the adolescent to think before he posts. Think is an acronym. It stands for, is it true? Is it hurtful? Is it illegal? Is it necessary? Is it kind? And if an adolescent is being cyberbullied, Childline 1098, cybercrime.gov.in is the place to report. The child has to be told not to delete that message, to save that message as evidence. Yes, media has changed peer relationships. As a health professional, we should know that peers are now available 24 hours. Peers are now influencing adolescents in a big way. Peers, yes, provide social support, but they can be also cyberbullied. So we have to do a lot of learning in this context of change of peer relationship. Coming to my last case and our relationship with a child and an adolescent, and how our relationship can make a difference to a child as the child is growing up. So this boy came with the parents at the age of 3 years when the mother said he is rubbing his thighs all the time. He's lying on his back and he is rubbing his penis. Easy to understand here. It was masturbation. We ruled out urinary tract infection, worm infestation. We also ruled out intertrigo fungal infection and reassured the mother. At the age of 12 years, the mother said, oh, he's wetting his bed sheets at night. This was a case of wet dreams nocturnal emission. And the child was made to feel very, very guilty. Once again, counseling the mother, counseling the father, also counseling the child made a whole deal of difference. And at the age of 13 years, the parent came back and said, look, doctor, my child is very sexually charged. I saw him watching porn. And then talking about sexual relationships, safe sexual relationships, the concept of privacy, boundaries, and the concept of what porn does, how does it show a relationship in an unhealthy life, and how to really control yourself safely. And when this child was 18 years old, the child came up and said, I am in love, doctor. This is the most beautiful feeling. After a couple of months, he came back to the clinic with a sighing episode. And he had already seen a pulmonologist, an allergy specialist, a psychiatrist who had put him on fluoxetine because of anxiety. What did I do? I just talked to him and we sat down and wrote down about this girl who had broken his heart because she was in multiple relationships. And when we wrote down about what kind of a partner that he had envisaged for himself, he said, oh, doctor, this girl is beautiful, but she is not at all a partner that I was looking for. The sign went off. This boy went on to complete his BTech from IIT, went on to get MS from a US university, and called me from US and said, I have found the girl of my dreams and I am using all the skills that you taught me about safe, happy, healthy relationships. And now he came back to India a couple of months ago, and the circle of life was complete with his beautiful wife and his small daughter, and said, would you be her pediatrician? So you can see the relationship of a child with a pediatrician made all the difference for this one person. When we talk about sexuality, we must tell our adolescents about healthy, unhealthy, abusive relationship. If nothing else, ask 4 questions. How will your relationship affect your life goals and value system? Are you ready for taking the responsibility or the consequences? Do you have the emotional maturity? What are various ways of expressing sexual intimacy? If you have more time and you are in a school setting, please remember to do these windows of sexuality education for both online and offline behavior. Talk to them about the need for physical intimacy, understanding them about their hormones and how the hormones make them work in this period, their need for having a relationship, the importance of privacy, consent, boundaries, establishing happy, healthy, safe, responsible sexual relationship, talking to them about puberty, hygiene, healthy lifestyle, pregnancy, abortion, STI, all the problems of the media like revenge porn, pornography, talking to them about drugs, dating violence, and finally talking to them about abuse and laws. And this actually is a comprehensive sexuality education. And this is an Indian-based module which is available at the NIMHANS website. And I would recommend all of you to go through this. As I come towards the end of my presentation, I just thought I would share this slide to again reinforce that, in fact, adolescent romantic relationships can form the basis of healthy adult marriages. When an adolescent has a breakup, like one of my patients did, he understood what he did not want in a relationship. Though it is tough for them, it is hard learning for them, but this actually helps them to form healthy marriages in adulthood. So as you can see in this particular slide, there are a lot of influences by the peer, by the family, by the culture, by the adolescent themselves, by what kind of relationships that they have in their adolescence to finally go in for a healthy, stable adult marriage. And now we come to the last concept which I would like to share. Our relationship with young people is undergoing a change. We know what adolescents know what is best for them. So we are now going to have a meaningful youth partnership with them, a meaningful youth engagement with them. We are going to ask them, how was my session with you today? What went well? What did not go well? How would you like my session to change? When they come to the clinic, what do you like about the clinic? What did you not like about the clinic? Oh, the restroom was not clean. I will make sure that it is clean the next time. Oh, the receptionist was not friendly. She said something offensive to you. Can we share power with the adolescent? And this is really going to change adolescent medicine for the better. And we just celebrated International Adolescent Health Week, where we shared power with the youth, where they decided how the week should be celebrated. So you'll all agree with me that healthy relationships enable adolescents to survive, thrive, and flourish in adolescence as well as over the entire lifespan. Adolescence is an age of vulnerability and opportunity. We must give anticipatory guidance and life skill education about building healthy relationships. We should use HEADS, a tool for screening the quality of relationships. We must be aware that difficulty in initiating and maintaining relationship may be a flag sign of mental distress, neurodevelopmental disorders, and poorly controlled mental and even chronic medical disorders. Diabetes mellitus, poorly controlled epilepsy can also lead to faltering in relationships. Relationship counseling must focus on building self-esteem, interpersonal skills, communication, and conflict resolution skills. Finally, meaningful engagement with the youth components of adolescent-friendly health services and adolescent-friendly policy. So in the end, I would just say that nurture your relationships just like you would nurture a plant, and not just your relationship with others, but also relationship with yourself. And I hope that this presentation would motivate you that to help adolescents to build a wonderful relationship with their nation, with their family, with each other, and with us. Thank you very much for a very patient hearing, and I apologize for the technical glitch in between that I faced. Thank you so much.
Thank you, Preeti, for that lovely presentation. As usual, very, very vocal, very, very vociferous, very, very committed to this cause. And I'm sure that all of us are happy that we have adolescent pediatricians. So doing only adolescent work. You know, we have these child development people, development pediatricians doing only development pediatrics. It's very difficult to do all that you said, being a general pediatrician. You know, to do adolescent work and go counsel the peers and schools and talk to the parents, and it means a lot of time. And I'm not sure whether any of us are ready for all this. You know, we take it up as a passion and as a single-minded, devoted. Adolescent pediatricians are scarce. What do you think?
Yes, sir. But I would say where there's a will, there's a way. And
yeah, how many people have the will to do just that?
It's difficult, sir, but we should also realize that, you know, just trying to counsel the adolescent may not be the only solution. Unless we are able to help the family, help the adolescent in the school. I'm sure, sir, as a developmental pediatrician, you must also be doing the same. You must be also talking to the family, talking to the school. At least I think this is the minimum that we can do. The peers, sometimes I have an advantage because I'm already associated with that school. And for me to just say that I want to take a life skill class is not a very difficult option, though I think that would be the main problem. But as far as the teachers and parents go, I don't think there should be a problem. That is what is my thinking, sir.
Well, Deepa's put up a question saying, what about live-in marriages? Is adolescents are on live-in marriages, live-in relationships? What their mental status after that?
So, Deepa, I would say, you remember those 4 questions that I asked, if we can't do the, detailed sexuality, kind of education and all that. So the first thing, the question is, how does this relationship fit into your goals and value system? Your goals of life and value system. Okay. See, here, as you know, in counseling, we are not directing the adolescent what to do, or directing the youth, for example. I presume that it's a youth when you're talking about a live-in relationship and not an adolescent. That is what I presume, because adolescents are still so much dependent on their parents as far as the finances go. So we just allow the youth to introspect, right? Does it fit into your value system? Does it fit into your goals for life, right? The second question, are you ready to handle the consequences? So what are the consequences? The consequences could be emotional. The consequences could be health. The consequences could be social. The consequences could be legal. Okay, so we have these 4 consequences which we should be able to put out to the young person. So what are the pros and cons of each level of this, right? My third question would be, do you have the emotional maturity, knowing that the adolescent brain, giving the science into it and saying that, yes, you are fully mature only by 24 years. And yes, if they're less than 24 years, to speculate whether the person is what he really is, or would the personality change as they grow a little older, right?
Okay.
Can you handle all these consequences, right? So these are some of the questions. So I'm not here to tell whether it is morally, socially, legally, emotionally right. The adolescent or the young person, I would rather say the young person, has to take a decision. And if they have a plan of action ready, how are they going to answer the questions what the society asks? If they have a child, what would be the position of the child? Are they using contraception, right? What if the relationship breaks? What is the backup plan? So it is not that we are shouting negative, we are just preparing. So it requires much deeper counseling than even premarital counseling. At least premarital counseling, they're going to get married, right? And which is legally so much sanctioned in the current scenario. So these are some of the things which we need to just reflect and take it from there.
Now, this love and infatuation. See, when you talk to adolescents about infatuation, is what is happening to you all, and it's not love, which love or caring is something that's totally different. They say, no, we are mature enough to do it. We're mature enough to understand love. And it's very difficult to explain to them that it takes a lot of understanding to really fall into a relationship where you care and you love, where jealousy doesn't matter. You trust, the total trust in the person, and the feel for the person is there, which happens only with time. Now, how do you explain all this to adolescents?
Again, so sometimes giving examples which have been, so widely projected in the media, that would be one way of doing, because we're just sharing with them, this is what happened. What do you think went wrong? So that would be one way of doing them. Again, also asking these Socratic questions. I use this Socratic questioning quite a lot in my counseling. When I say that, what if you were to see your best friend holding hands and kissing her boyfriend in a park? What if? What would you think about this friend? Right? What will other people think about this friend? So these are some of the questions which we ask them, which could be reflective. But what I have seen is, just like in drug use, telling them about the brain, this makes a whole lot of impact on them. Telling them that it is natural to have that feeling of attraction, as we say. And like I said, again, writing what kind of a life partner do you have in mind for yourself? Would you want somebody who keeps changing with time, or who's a relatively stable personality? So as we are allowing this personality to grow, can you have your boundaries, as we say, Lakshman Rekhas, for your behavior? The fourth question is, even if you're emotionally attracted, how are you going to express your emotional intimacy? There are many other ways which are non-sexual ways of expressing emotional intimacy rather than the sexual act. And when are you going to do the sexual act? As sir is mentioned in your life skill book, honesty, sincerity, integrity. Are you ready? Have we discussed the consequences? What will happen if we indulge in the sexual act? Right? Is this person asking you that if you don't have sex with me, I'm going to break up the relationship? So where is the trust? Where is the personal freedom? Is he respecting, or is she respecting your personal choice? So we have to give them a checklist which may be useful, telling them, take time. A person who looks like a hero today or may turn out to be a villain or vamp later is my typical thing, which I say in a very kind of a, with a little bit of humor in that. And take your time, have your boundaries, do not meet each other alone, meet each other in public or in a group, get to know each other well, whether that person is trustworthy, whether that person stands up for you, whether that person nurtures your dreams or not. So this only comes, sir, and trying to give them that pause, the orange light before the green signal. So we are not giving a red light here. We are not telling you cannot do this. What you have done is wrong. We are telling them to put on their orange light in a traffic signal. And before you go, you think where you want to go, how much you want to go. Are you ready for the consequences?
Meena Krishna has asked, where do you get life skills training? Where you get life skills classes done? Dr. Meena Krishna wants to know where to get life skills training.
So I think I would request IAP Kerala and AHA Kerala to start life skill classes. I think that is a wonderful suggestion which comes. And we have the master of life skill training, Dr. Unni here. I think whatever I know about life skills and whatever I still can recollect because of his awesome teaching. He's a great trainer. So I think we should start life skill classes. I'm all for it. I can also help. It says actually the CBSE has a program which is a life skill based program. I think because of the pandemic, everything has been put on hold. But if IAP Kerala and AHA Kerala take this decision, I'll be more than happy to help.
Any other questions, Deepa?
Yeah, ma'am, one more thing I had. Am I audible?
Yes, yes.
Yeah, ma'am, actually, no. How is it the same way that a parent should react when they come to know like their son or daughter is in a relationship?
How should the parents react? Is the question?
Yeah.
Okay. So if I can just frame what really happens in my clinical scenario is the parents would have seen them together somewhere, and or they have caught some chats on the mobile phone. That will be the time when they say that oh, she's in a relationship, what should we do? And they come back and then they are all this thing. So my take with the parents is that first thing, it is normative. Okay, so that is you have to make it normative that attractions do occur. Otherwise, they'll be so anxious. The parents, we have to cool them down. We have to again tell them, respond, do not react. Some parents can get very violent when they come to know, So that is another thing. The third thing is, I ask them, have you talked to your child about relationships, right? And also with the opposite sex or about intimate relationships. Most of the time, the answer is no. They would have never talked to them. Oh, doctor, they should know. They know about each and everything. They should know. But I must tell again here, unless parents tell that in my family, so parents have the right to explain their family values, that premarital relationships we do not like. But as a counselor, I cannot be a parent. I can only be a counselor where I can, talk to the child about the pros and cons and help the child to make the right decision within her or his value system, right? So there's a difference. But a parent can definitely say this, that this is not the done thing in our family, right? They say it's not the done thing, but why is it not the done thing? That is what the adolescent wants to know, right? So here we help the parent to put down their thoughts together, why they think this is not the done thing. I most of the time encourage parents to talk to the adolescent about these issues, but they refuse. They say, we don't have the training, we understand what you are saying. So then I say, get the adolescent to me. Okay, so that is better than they hitting the adolescent at home. And the one promise which I extract from them is, don't taunt the adolescent. You're a bad character, you're a prostitute, you're a pimp. Parents can go totally berserk with their language when they are coming up with such a problem. So then coming to the adolescent, talking to the adolescent, again I said the same things which I said before, saying, where do you stand? How does this relationship fit into your life is very, very important.
Okay, Vidhu Ashok has asked that if an adolescent is attracted to the same sex, how to handle the child and the parent?
So again, like I said, the same principles hold good. Then it's either same sex or opposite sex attraction. No coercion, no violence, accepting personal boundaries. Now, suppose it's a boy and he says, or a girl who says, I'm attracted to the same sex. Okay. They come up with around 12, say about 13 or 14 years. Usually they'll come up with this in the middle adolescent period. First thing is remain calm. Okay. Oh, you can't do this. It is this thing. Or some celebrity has, influenced you or things like that. First thing, remain calm. Okay. So you are attracted. So how do you want to take this forward? Is the next question you want to ask. Oh, I'm in love with this. Okay. So how long do you know this person? What are the good qualities of this person? Oh, I just met him once and he's so fascinating. Okay. So that is one good thing. Any other qualities you know about this person? Give time. Again, the same concept of giving time to your relationship, about assessing the person, not forcing yourself into to the other person, not forcing to touch that person or force the person into a sexual act, respecting boundaries, respecting privacy, consent. All these are as good in opposite sex or in same-sex relationships. But as a health professional, how do you actually carry on and help this child? Because usually the sexual orientation gets established by around 18 years. Till that time, there is a stage of confusion. And at this time, the adolescent needs hand holding and not being, blamed. And some of these adolescents are also bullied in school. Okay, and some of them, the boys especially, may be effeminate, or girls may be a little masculine, and the peers are quick sometimes to find out that they are different. So also telling them that if there's a problem in school, let me know. Also again, partnership with teachers, parents becomes very, very important, especially in these cases. And as they grow older, giving them the support and finally telling them how to come out. Sometimes the adolescent may not want to share with the parents also. And they want to take their time to come out with their orientation. So give them that time, I feel, and be supportive. That's how you would go about it.
Preeti, see, one important thing with regard to homosexual relationships is, first of all, you have to make sure that it is a homosexual relationship. Meaning to say, a lot of benign homosexual exploration is extreme. A little bit of benign homosexual exploration, physical homosexual exploration is very common during adolescence as a part of trying to understand what is physical sexuality. Like
absolutely, that is why. Absolutely correct, Newton. I fully agree with you. And even this exploration, though we know it is normative, it actually falls under the purview of sexual abuse. So also telling that, touching somebody, also telling a little bit about the POXO law becomes a little important as we are trying to deal with this issue in a sensitive manner. So I totally agree with you that we need not jump to make a conclusion about the orientation as they grow older. The questions to ask would be, when you masturbate, what images come into your mind? Is it a female? Is it a male? What arouses you? So these may be pointers later to really, kind of know whether they have a homosexual orientation or not. So, but
Yeah,
as
totally.
you said correctly, we have to not jump to, say, oh, you're homosexual, or go and jump and tell their parents. I totally agree with you.
Yes, that's the point that I wanted to get out of you, that their sexual fantasies are quite accurate, give you a more accurate picture of what is the actual sexual orientation, whereas some minor homosexual physical act may not be truly to their personality. Like last month I had a boy who was extremely worried. He had a good friend, and they've been classmates and friends in so many years. And now they're studying in the same college. Both are very serious. They are now staying in the same dormitory, staying together, and they are very good friends. And then a little bit of homosexual activity took place once. From that day onwards, both of them are in a state of panic. Are we basically homosexuals? Are we gay? And so they're terrified, they're unhappy. Finally, one of the boys went to his teacher and told her about it. And she couldn't handle it. So she asked me. So when I asked the boy, I spoke to him over the it was a tele video counseling. When I asked him about it, I just asked him to tell me all about it. And very reluctantly, he told me the whole story. And it turns out that it's actually a very good friendship. And they were wondering whether they have to break up the friendship in order to protect their own futures and train themselves to be heterosexual. So first of all, sexual fantasies were of the opposite sex. Secondly, I asked him about himself. He says very clearly, like he's got good boyfriends, good girlfriends, and he finds girls a little more exciting to talk to than boys. In a different type of friendship, it's a little more exciting. So then I asked him, I talked to him about homosexual exploration being a normal phenomenon, and that if you have this type of feelings, most likely you are not a homosexual. Well, I asked them to just continue the friendship. They want to break it up. So I told them that you've got a very strong, good friendship going on. You must continue the friendship, even though now you're going to be separated for 1 or 2 months due to circumstances. But you must continue the friendship. Keep up this good friendship. But this period of separation itself will give you an idea of whether you are a homosexual or not. And then after 1 month, we will discuss this further. So I'm waiting for his reply.
Yes, that's wonderful, Newton. I also feel at this point of time also to tell them a little bit about the risk of HIV, the risk of sexually transmitted infection, also a little bit about anal sex, the use of condoms. I think these are the things which we should be talking to them, especially when they are living together and they have had a homosexual experience. So it is more like an education. Like I said, one more part, they should know the consequences, because we really don't know what the orientation would be later. So and it's not only for homosexual, it's for any sexual relationship. I think HIV prevention, all that needs to be talked about in sexually intimate relationships.
It's 9:15. Shall we wind up, Deepa, or any more questions?
I think so.
It's been a lovely session, Preeti. I'm not sure of this POSCO Act, if it is really working, because when these young boys are reported for some misdeeds, what happens to them when these investigations take place is something that is very distressing, because some of them don't land up with the final decision also. So what's your any experience on that? Young boys getting into this, being reported for some POSCO activity that they.
So are you talking about the adolescent boy and girl eloping and the boy getting? Are you talking about that?
Yeah.
Okay, right. So yes, the POCSO Act is supposed to be gender neutral actually. But the fact of the matter is that it is heavily biased towards girls, right? Even though the girl may be the one who would have probably pushed the boy into a sexual relationship. It's the boy who's behind, who's the one who gets the detention, right? So we must be aware about it. And as Sir said, in the recent times, there have been few judgments which have acknowledged that if the age gap between the adolescents is not too much, and to consider it as a normative sexual behavior. And some judges have been kind enough not to give harsh sentences to the adolescents. But yes, as far as the law goes, the law is very clear that less than 18 years, any sexual activity is actually comes under the act. And so I think the only thing the only way out that appears to me is that we should be talking to adolescents more and more and telling them that, yes, there is a law here. You could be in trouble if this happens. So that is probably one way. But I also know that Dr. Shekhar Sheshadri is doing a lot of work in trying to change the law a bit towards in favor of the adolescents, especially when the age gap is not too much and when they're both in the late adolescent period. He's also doing a lot of sensitization for the judiciary to be more kind and to be more accommodating and to understand and keep the children for more counseling rather than, being very punitive with them.
But most of it is very impulsive. Some of them have a genetic predisposition to this. So it could be harmful to the society.
Absolutely, sir. Absolutely. So I think what they need is a very good psychosocial and mental health care, which has to come as a backup, which is very, very important. Like I said, sir, 26% of our Indian population is below the poverty line. And in fact, if we are just going to just do it simple maths, 26% of our infants are going to have impulse control disorders. So we have to be ready for that. That's the effect in utero of poverty.
Okay, there's one question again by Vishnu Ashok. I think this will be the last one. Deep involvement of an adolescent with a person whom they had met on social media. How to counsel them?
So can you just repeat the question? What is the question, sir?
Deep involvement of an adolescent with a person who they met on social media. How to counsel them? Okay. Social media and maybe cybercrime. Maybe cybercrime. I don't know what he's meaning. Maybe
so again, I think let's not get too judgmental about it. I think what we need to do is we also know that nowadays there are dating apps which many of the young people use, especially in COVID when they didn't have the opportunity to meet others. Yeah, so somebody's already written it's a dating app. So when it's a dating app, it also gives you, see, there are some rules of relationships which are changing with the social media. When you are thinking that you like the person, you remember we had pen friends before, right? We never met that person. We used to get letters from pen friends. So if you can just extrapolate that to social media, it is something like that. But if you're going to build relationship on that, you must see the person. So the first rule is, if you want to go beyond just a pen friendship, so-called pen friendship on social media, please do a video chat. Please do a video chat. Look at that person, who that person is. For all you know, he may be a child abuser. He may be a criminal. He may be some 40-year or 50-year-old and you are just around 15 or 16-year-old, right? So see the person, who the person is. That is rule number one. Second rule is, think of setting up a meeting with the person in your home or with some adult whom you trust. Even if you don't want to tell your parents, let it be some trustworthy adult. Never to meet this person alone. That is the rule number two, which you have to really emphasize when this person is on a social media relationship, right? Unless you meet the person, unless you see the person, the relationship cannot go any further. And then the same thing, trust, communication, mutually enhancing relationship, all those things have to be looked into. So just saying, so many things, you can write a lot of things, but they may not be true.
Thank you, Preeti. I think we'll stop here. Let's have vote of thanks. Who's doing the vote of thanks, Deepa?
Yeah, sir. I'll begin. Good evening, one and all. Respected MKC sir, Kamath sir, Preeti Galgali ma'am, Jason sir, Vijay Kumar sir, and all the dignitaries and seniors here. Let me take this opportunity to thank our most respected MKC sir for blessing this occasion with his gracious presence and for inaugurating the webinar series. I would like to thank Kamath sir for being the guest of honor today and for sharing your valuable thoughts with us. We have all seen skilled surgeons beautifully dissecting various anatomical structures out of a messy tumor. Likewise, today we saw how Preeti ma'am so beautifully made such a confusing topic so clear and manageable. Thank you, ma'am, for giving us such a wonderful talk. I would now like to express my wholehearted gratitude to Jason sir for moderating this session so well. Thank you, sir. IAP Kerala has always supported AHA Kerala in all its activities, and it was no different this time. Let me thank our Honorable President, Vijay Kumar sir, and Secretary Johnny sir for all the help and support extended. I would like to express my gratitude to Joe sir, Jayaraman sir, and Ranjit sir for sparing your time and giving your felicitations. A special thanks to Newton sir for your valuable inputs. A special word of thanks to Team IAP Kochi led by Naushad sir and Rekha ma'am for all the support and participation. It would be wrong on my part if I don't thank my own team members of AHA Kerala, Chairperson Shibu sir, Treasurer Sanju, and Ranjit sir for all the guidance and help provided. The life of this program was my dear friend Dr. Shweta B. Ram, who hosted this program so beautifully. Thanks a lot, Shweta. And last but not the least, I would like to thank all the participants because it's your presence that has made this program a huge success. Thank you all.
Thank you so much. Thank you very much, Jason sir.
Good night.
Thanks a lot.
See you. Bye.
Thank you. Thank you.
Thank you. Thank you, sir. Thank you, Jason sir.
Thank you. Bye.
Bye, sir.